Well, good afternoon, everyone, and welcome to today's webinar, which is one injury. Somehow you end up with two recordables, and it's that return to work decision that can sometimes create that next injury. So in case we haven't met or you're new here to the webinar, my name is Holly Foxworth. I'm a registered nurse and I'm the Vice President of Marketing and Communications here at Axiom Medical. And I have the pleasure of being your host today. So what I would like to do is kind of start you guys with a scenario that I'm sure that you've all experienced at some point in your career, where you have a worker that gets hurt. You treat them, manage the claim, you think that they've improved, all of a sudden they come back to work, and then a few weeks later, they're hurt again. So you're sitting there and you have the same person, but yet many times you'll have another recordable that's on top of that. And so it's like somewhere back in the back of our minds, we're starting to think as employers, you know, did we cause that, or could we have contributed to that? And the answer in a lot of cases is yes. Not necessarily because it's intentionally, not because it's carelessly, but it's yes because that return to work decision was solely based on incomplete information. Because there's a big difference between cleared and being ready. And so many times you'll see that they will stop that monitoring process once that employee walks right back into the door. So that's really what we're unpacking today. We want to talk about not just why re-injuries happen, but also what that window actually kind of looks like and what some of our strongest programs, our clients and their safety programs, what they're doing differently to keep that second OSHA recordable off of their log. So by the end of this hour, there's one thing that I hope that you walk away with, and that is I want you to look at every return to work decision that you make from here on out. Make that as a risk decision, because that's really what it is. It is a risk every time that there's an injury occurs and they're coming back. Normally we're excited and we're grateful that all of a sudden they're back, but that is really a risk decision. There's always risk that comes along with that. So we put together a fantastic panel today to discuss this. Some of the faces are familiar. I'm sure you're familiar with Dr. Scott Cherry, who is our Chief Medical Officer. We have Dara Wheeler, who is our Chief Marketing Officer and EVP of Product and Innovation. And then we also have a face that you guys may remember from some time back, but we brought back Dr. Marley. He's an ergonomist and he is a sports medicine doctor for physical therapy. So he does a lot of return to work exams. He's in the trenches and he's seen this played out so many times. So we'll definitely let you meet them here momentarily. But just a few quick things before we get started. If you have ever wanted to initiate a safety program or purchase something for safety or whatever it may be and told no, I'm sure all of us can relate to that at some point. We want to change that. We want to be able to tell you how it is that you can build the business case that's going to get approved for your safety program. So next month, our event on July 16th at 1 o'clock, it's called Speak CFO, How to Build a Safety Business Case That Gets Funded. And all you need to do to register for that is just click that button there on the right-hand side of your screen. It's at the top. That'll get you registered. You don't have to do anything else with that. You guys will love. We're actually bringing on our own CFO. His name is Kevin Campbell, and he's one of the most down-to-earth and relatable, brilliant CFOs that I've ever met in my entire life. And he speaks in language that we can all understand. But he is really that bridge that's going to be able to help us to understand what to say whenever you're wanting to ask for something so that the CFO can approve that, so it becomes a no-brainer. So definitely mark your calendars for that. We want to make for sure that you guys are able to take advantage of his wealth of knowledge there. Second thing I was going to mention was use that Q&A chat and the Q&A box. I'm seeing all these hello from North Dakota, North Carolina, all of these. I see Renee there from Georgia. Fantastic. You guys are doing a great job there with the chat. We love watching this, and we watch every single comment that comes in. because we learn from you guys just as you learn from us. So if there's anything that you want to share in there, something that's happened to you, maybe something that you're facing, something that's going on, maybe you've had a situation like this in the past that you want to share, or you have a best practice, drop that in there, because you'll see that the other participants will comment back on what it is that you're saying, because they're so desperate for information on how it is that they can improve their own programs and be able to hear from fellow colleagues and peers who've been able to make it across that finish line. So, so make for sure that you use that chat. And I do like to send out gifts after these events. So use the chat. I'm watching that. And those that are the most engaged, you might just find a special surprise that's sitting on your doorstep next week. So make for sure that you utilize that. Speaking of showing up real quick, we will be at ASSP Safety 26 in Anaheim, California. This next week starts on Monday. If you do not already have tickets and would like to have free expo tickets or attend our after hours VIP event that we're having at one of the Disney locations, Disney properties, make for sure, drop your name in the chat there and we will get you an invite immediately. So just put your name there in the chat, say what you need, and we'll make for sure that we get you on the list. So those are the biggest things. I will tell you that today's session, it does qualify for SHRM credits. So in order to receive that, all you need to do is stick with us for the rest of the hour. You'll reach at the very end, you'll see that there's a survey, you fill out the survey, and immediately you can print out your certification. And then obviously slides and resources are located there at the bottom of your screen. And we'll send out a recording of this, usually within 24 hours, in case you want to share that with one of your colleagues, somebody that you work closely with or you think that can benefit from that. So at this point, let's go ahead and introduce our guest. Dr. Cherry, let's start with you, followed by Dara, and then we'll go to Dr. Marley.
Thank you, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I've been with Axiom now about 8 years, and my professional background is I'm board certified in preventive medicine and occupational medicine. And I've been supporting the military, the government, industrial operations, corporate operations for the past 20 years. And it's a pleasure to be with you.
Thank you so much. I appreciate it. How about you, Dara?
Hey, everybody. My name is Dara Wheeler. I am Axiom's Chief Marketing Officer over Marketing and Product. I have been at Axiom for a little over 20 years, and I love supporting our clients and everything that they've got going on. And I saw somebody just said, they're going to come hang out with us in the ASSP after hours event. So I look forward to jump on that. Dr. Cherry will be there, I'll be there, and one of our great partners, Epicor, will also be there. So hope to see you all there.
Absolutely. Yeah, definitely. How about you, Dr. Marley? Tell us about you. Dr. Marley, I think you may be on mute. Let's see. Dr. Marley, can you hear us? He was just talking, so I know that I know the speaker works. It's just a matter of you may have to go back out and come back in. Sometimes that works a little bit better, but definitely we will circle back around to you since the sound isn't coming through. But before we kind of get into the data, what I really want to know is I want to hear from the room, because I know this isn't kind of theoretical for you guys, is that what we know and what we can kind of start with is that there's one number that should be getting everyone's attention, which is that 1 in 4 of these workers that have been injured, that some of those certain injuries, those are getting hurt and then they're returning to work and they're getting hurt again. Most of those second injuries, they're totally preventable had you made sure that they had done a return to work exam, you knew for sure that they were definitely ready to perform their regular jobs. So it's not necessarily that it's a small operational problem. It's usually more of a program design program. Dara, when you look at that number, kind of what does that tell you about where most return to work programs are kind of breaking down?
I think there's a few spots, and I'd love to hear Dr. Cherry's comments on this as well. I think there's a lack of coordination in general across injury care. When you think about the way injuries get handled and the various stakeholders within an injury path, that handoff process is often very inconsistent. And when you think about a return to work specifically, and when you're working with employers that have modified duty or some sort of way of returning employees back to work, which we know when you bring somebody back to work on modified duty, it really does help drive a better and faster return to work. If there's a lack of consistency around that process, and often we've been talking to a lot of employers about this. Often they're worried about instituting any sort of consistent program because of regulations and various concerns. But what ends up happening is that they end up inconsistently applying a return to work process, and either only applying a process to some individuals and not others, which actually ends up being more discriminatory than if you had a general practice. So when you think about injuries post return to work, what I think happens is a couple of key areas in addition to the lack of coordination is you have an employee, especially in a safety sensitive role, who has very specific physical demands of their job. And when they have those physical demands, if they're out and they're being returned to work by a physician, sometimes there's a mismatch between what the physician understands about their job duties versus what the injury is. And I don't think it's the physician doing anything wrong, but sometimes there's a mismatch of understanding. And so an employee might get prematurely returned to work without fully understanding the job duties that are at hand. And so what ends up happening is somebody might be coming back to work faster than they should, or in a full capacity when maybe they shouldn't be coming back full capacity. And so there's a lot of nuance to that. And I'll pause and let Dr. Cherry weigh in on that.
Mm-hmm. Yeah, and this is really a significant proportion of injuries. And when I was doing some of my preparation, I came across some studies that reported up to 40% of certain types of injury, like low back or just musculoskeletal injuries, which are some of the most common ones. Up to 40% can be re-injured pretty quickly. And so when you think about these soft tissue injuries, like a sprain or strain, which again are the most common, how the body heals is the pain response is that initial inflammatory response. And that can be up to the first week. And then the pain signal potentially goes away, the swelling goes away, but the body is still technically healing. So it may take up to, several weeks or months, depending on the nature and severity of the injury. So although the signs and symptoms that the provider is seeing and even the employee is seeing is reassuring, they might be returned too quickly. And especially if it's not graded duty, right? And so someone who might feel subjectively ready to return to work, even if they're cleared, they may not be fully ready. And then again, we're just talking about the physical aspect of the injury or the biological side. And, we've been looking at more of the holistic aspect of an injury or of an employee now. And so the psychosocial aspect of it, how is that person thinking about their injury? What are their constructs about their pain, their capability? So having a holistic approach will actually lend a lot better outcomes for these injuries.
I agree completely. Dr. Marley, are you able to hear us and speak? I don't think so. Okay. All right. No worries there. Well, what I would like to do is, we can hear you. Yeah, there's a little bit of a background. Good
Okay.
background
Is that
echo.
better?
Yeah, that's better.
It seems
Yeah,
like you might have called in as
Sorry.
well. I'm seeing.
yeah. Tell us where you're located, Dr. Marley, and what it is that what you do.
Yeah, so I'm located in Bloomfield, Connecticut. I'm a sports medicine physical therapist and ergonomist. I work primarily on workers' compensation claims, helping companies and individuals return to work, as well as just making sure that their employees are safe to perform those job duties, and helping companies make sure that they have ADA compliant functional job descriptions that we actually utilize to test for post-offer screenings, as well as safe return to work demands, and helping with the return to work process as a whole.
Fantastic. Well, thank you so much for joining us today. We appreciate it. We know that you have a patient that you have to see, so you may have to cut out a little bit early, but please feel free to jump in anywhere and everywhere that you would prefer. But at this point, I'd like to kind of turn to the audience, and there's no judgment here. So this is a judgment-free zone. We know that everybody in the audience, we have an audience full of safety professionals and HR professionals, return to work professionals, and you guys are all doing very hard things under a lot of real pressure. And so, but what I want to ask is, what has actually burned you in the past in terms of return to work? Would you say that maybe that the employee was sent back too early? Would you say that they were put into the wrong job whenever they came back? Maybe you didn't realize that they were still struggling with the injury that they had, or that you found out too late. So drop that in the chat. I'm really interested to hear kind of what you've experienced personally. Dr. Cherry, what would you say that out of this list, what would you say would be the most common?
Can you repeat the list one more time for me, just so I can kind of weight it in my mind?
Yeah. So it's actually, we were asking what's kind of burned you in the past. You know, where have, just like we hate it when employees go to a clinic and they're given an 800 milligram prescription of ibuprofen, and it just immediately turns the case from first aid to recordable. What we were asking was, where have you found yourself burned like that before? Especially whenever there's a situation where somebody's returning to work. Do you feel like that it's because they've been sent back to work too early? Do you feel like that maybe they were put back in the wrong job whenever they were sent back? Maybe not realizing that the employees were still struggling with that injury that they previously had, or maybe you found out too late.
Yeah, I do think it's most common. I do think it's a capacity mismatch, and we'll probably talk about this more throughout the presentation, but if someone's even on over-the-counter pain medication, it may mask, some of their symptoms. And if they're working at a role that's over their capacity, if they've, or near or over, then they're much at higher risk for, you were kind of setting them up for failure. So you really do want to have, some thoughtful approach to, again, how you manage these types of injuries.
Absolutely. Looks like Michelle, I like what you said. She said, we've been very blessed in the aspect we send the employee to work. Let's see, we send the employee to work. It keeps moving. We send the employee to work hardening for several weeks and then test them before they come back. So test them. I would assume that that means that would be some type of return to work exam or functional capacity exam. So you're exactly right in terms of where that's going. Because whenever we kind of look at it, here's where the problem really comes up, and I think that Gary usually can explain this best, more so than anybody else. It looks like we had one more that said We have masonry construction company, high risk to return to work on job sites. Our practice is to bring the employee into the office for light duty while they're recovering. Interesting, very interesting. Thanks for sharing that, Renee. So that would fall into the area where, you're making sure that you're not putting them back into the wrong job. Definitely. Dara, there's a big difference whenever you look at those two words. They may seem like very simple words, but there's a big difference whenever we talk about cleared versus being ready. And it seems like that's really kind of the gap of where some of these re-injuries live. So talk us through what that distinction looks like, because I think a lot of organizations believe that initial sign off or that initial visit, maybe with a physician, is that ends where their liability ends at that point. And I definitely want to challenge that.
Yeah, I mean, I think it's actually similar to what Dr. Cherry was saying, especially with some of these musculoskeletal injuries and these various different types of injuries. You might have a physician helping manage the injury who says, yeah, they're cleared and ready to go back to work, but cleared and ready, yeah, like you said, are kind of two different things. To Dr. Cherry's point, also, the biopsychosocial aspects of injury, somebody might technically, physically be able to go back to work, but are they going to be injured again? Or are they going to have another injury that is worse the second round? And I think thinking about a more holistic approach to what does ready mean versus a check the box kind of approach, then that's a big difference.
There was a really good question that was asked by Ashley, which was, what does a return to duty or return to work exam actually consist of? Dr. Marley, do you want to take that one?
Each exam is a little bit different, right? So it's going to depend on that individual as well as what role they're in. And that's going back to, again, having ADA compliant functional job descriptions, right? So if there is a job description for this individual and their specific job, it'll tell us exactly what they do and what those requirements are, whether they have to be able to lift up to 50 pounds, push or pull with 25 pounds of force, whether they're doing more overhead tasks, kneeling, crawling, little dexterity movements, or if it's just a lot of reaching, twisting, turning, bending, stooping, right? So that's why those ADA compliant tasks are very important, because you should be able to utilize those to perform perform various tasks that kind of mimic a normal daily job for that individual, to see if they are able to meet those demands of the lifting, material handling, as well as just achieving some of those positions and postures, such as if they have to stand for, let's say, 4 hours throughout their shift, but they're coming back from a knee injury, right? So now you're going to do more of that standing, more of that stooping, bending, and just, again, making sure that they are cleared in the sense as they are able to do those with no restrictions, and we're seeing what those restrictions might be.
Absolutely. Looks like we've had some other answers that came in that were great as well. Amber had mentioned we contract with the local clinic for all our pre-employment, annual exams, post-accident, fit for duty, return to work. And she had mentioned that they have protocols established with all of them with job descriptions for each of those positions. Man, you are so far ahead of the game that you have provided your clinic with those job descriptions. I bet Dr. Marley would just think that you were an angel if he was seeing some of your employees. But she mentioned that provides them with a second layer of evaluation, just to make for sure that they're fully aware of any type of limitations or restrictions that are there, and that personal doctors aren't necessarily aware of the physical requirements of the job. And that is such a good point when it comes to these personal physicians. Do you see that, Dr. Cherry? Do you agree with that statement about the personal physicians?
Yes, definitely. So if you're doing pre-placement exams and you're not submitting, the job description, hopefully with a fairly accurate physical demands analysis included in that, the clearing provider is relatively blind, and depending on just their experience, you may, it can be variable for each provider. So being able to provide that, job description and physical demands analysis can really provide a lot of insight. And then, there's kind of tiers to the levels of validity to your program, right? So then I would say, again, the next step would be to actually, once they're medically cleared, then to actually do a functional capacity evaluation just to make sure there's actual measurement, right? Like the medical clearance is looking at medical conditions that would make it very clearly unsafe to do the work.
Mm-hmm. Yeah. Dan had written in and talking about a well-written job description is essential to safe and effective return to work programs because it defines those job duties. I completely agree. And there was one more that really caught my attention. I think it was the one about most of our injuries have weight restrictions. So employees are able to either sit and work with their hands while they're there in the shop, either tagging, rebar, sorting things, whatever it may be, maybe some labeling, inventory. And Renee had mentioned that as weight or standing restrictions are decreased, that activity can be increased there in the shop or around the office. I completely agree with that.
Yeah. I love the call out on job description. You know that I will always go back to job description. If you have poorly written job descriptions without well-defined physical demands, it is going to be very difficult to manage process appropriately in any sort of injury care. And I think my first question to groups is usually, tell me about your job descriptions. And when Dr. Cherry and I are doing any sort of program build or thinking about these types of programs, we always start with those questions because too often we've seen very poorly defined physical demands within the job description. And don't forget mental demands too, mental behavioral demands as well, because it isn't always the physical demands of a job, but there are other components. I know a lot of you have employees that are lone worker employees or doing things where they're field employees and they're on their own. And sometimes that can be a very stressful job to do on your own, especially when you're returning back from an injury. And now you're in the middle of nowhere, you're worried and kind of alone. And that can be something that could contribute to further injury if you think about it. We also think about the other pieces of return to work in terms of the mental capacity. I always say, we're all work from home employees, and we also have lots of people doing very mentally demanding jobs, not just physically demanding. So if somebody's returning back from some reason that they're out, and making sure that you're evaluating the match between job description and job return to work, you have to really consider all of those components of a well-written job description.
Totally. Yeah. I really like what Elizabeth had written in here because it reminds me kind of a story. Elizabeth had said that we try to bring everyone back light duty as soon as possible so that they don't fall behind. And, they're not kind of in that, well, now I'm off work and, I have to get paid just part of my salary, because it does. That gets very expensive. It can be very costly on the employee. And it's also, it's a strain on the employee themselves because they're not getting their full paycheck. What I really like about what you said and what resonated the most with me was a story that I was told just recently with one of our clients, and they had shared about how they had fallen from a windmill turbine. So you can imagine a windmill turbine, and the harness broke, they fell off. Thankfully, they lived. But long story short, while they were off work, no one contacted them. They didn't come back from light duty. Nobody had contacted them. And he just expressed to me, the amount of hopelessness and depression and everything that went along with that. And it broke my heart, but that is why this is so important, to get them back in at the right time doing those things. So I really applaud what you had mentioned there. Great insight. So now let's come test the room and ask you a question, because this one surprised me. So I want you guys to drop this one in the chat as well. What % of workers get hurt again after returning? So would you say that you think that number is 5%? Would you think it's 15%? Maybe you think it's 50% or higher. What would you think that number would be? And there's no wrong answers here, so don't worry about being judged there. But I definitely would be interested in what your thoughts are. Dara, I don't think you've seen the next slide, so I see Jill, I see a lot of 20%. Okay, 30%, 65%. Wow, interesting. Wow, okay, 20%, 15, 30. Okay, good deal. Well, Dr. Cherry, I'm going to let you talk through this and explain kind of what this number looks like and what goes along with that.
Yeah, when we look at the whole population of injuries, every type of potential injury out there, then we're seeing about 12% of injuries become re-injured after return to work. And certain injuries will actually approach 25%, 1 in 4.
We lost Scott again.
We lost Scott again, yeah. Dr. Molly, do you want to pick up here and help Dr. Cherry?
So what happens is we think that kind of that rushing to return to work is always better, but sometimes it could really be counterproductive, right? So again, depending on the injury, the mechanism, the cause of the injury, it actually heightens the chance of the risk of re-injury. So one of the biggest misconceptions that I have seen and witnessed in occupational health is that once an employee is medically cleared, that the risk has passed away and that they can just continue on with regular life. But in reality, some of these kind of that first few days or weeks back is actually putting them at their highest risk period for re-injury occurring during those times. And so we have to be very mindful of that, especially, for example, if it is someone that is working by themselves and they're going back to lifting those 50-pound bags or those same repetitive motions that once hurt them. So we see bigger re-injuries in situations like that. So these numbers are obviously a little skewed, and that's why we're saying in certain injuries, you kind of see it's more that 1 in 4.
1 in 4. Okay. Yeah. So I was actually going to come to you next as well. And, whenever we talk about where that highest risk is, whenever they return, we talk about, we want the employee to hurry up and come back. That's the goal, is that we want them to come back and return as soon as possible. But we almost never talk about what happens kind of in those first few days or weeks after they do return. It seems, walk us through that specifically about why it's so important within that time frame, because it seems kind of counterintuitively sometimes that we're rushing a return. It doesn't feel wrong, but it actually is creating an opportunity for another injury. So why is that time period so important?
Yeah, so that time period is very important just because, again, we want to make them feel good. We want them to be active and kind of not have that time off. But again, if we're just putting them back in the same situation to where they were injured before without, again, the proper training or taking proper protocol or making sure that they are physically fit, again, even though they were cleared and said that they can go back, we still have to ensure that, they have that physical capacity to meet those demands. If we just put them back in an area to where they're going to be standing for multiple hours throughout the day and they just had a back injury, that's just going to re-aggravate their back. And even if it's not the same mechanism of injury from lifting or something of that nature, again, they are at a weakened state. And so that's when they need more of that TLC, that loving care, and kind of giving them those certain restrictions or kind of knowing where they are physically so we can accommodate them.
Absolutely. Yeah. I love what Ms. Hernandez said about I work for a hotel management company, and if we can accommodate the restrictions, we definitely try to bring them back as soon as possible. However, some of our insurances that we work with, that they do offer what they call a return to work program, which means that if they're not able to accommodate those restrictions, that they can offer work in different organizations until the properties can accommodate those restrictions. I think that that's a fantastic program to be able to offer your employees. Absolutely.
I heard about one recently that does the same, and they help bring people back to work and do volunteer work in the community, which I think is a really cool concept, because if you think about just easing employees back in, at least they're working, they're participating, they're helping the community through volunteerism and service, and that's a really neat program that I just heard about recently.
I love that.
Also, Kane says that Dr. Cherry's internet needs to return to work, which
return to work program. You need a functional capacity exam for your internet, Dr. Cherry. I love that. Well, let's kind of talk about what those two different paths look like. And Darren, I'm going to come to you for this one specifically. What's the difference? I mean, it's like you can have the same injury, but yet they go down two completely different paths. They have two completely different outcomes. So what's the difference there?
Well, I think, like we've said a couple times, it actually goes beyond and earlier than the return. It's from the minute injuries are happening, or even before injuries are happening, having really good policy and procedure in place between job descriptions, your injury care process, making sure that all of these handoff moments are really cleanly supported across the continuum of care. Because I think somebody mentioned in the chat, or Holly, you might have reiterated this, actually Dr. Marley did too, one of the challenges is often employees are out, but everybody's a little nervous about who's communicating with the employee. And if the employer isn't having regular communication, often they feel like they can't or they shouldn't, and that their TPA or somebody else is supposed to be managing this. But when employees are at home and nobody's keeping them up to date on what's going on and why they're out and what the path is, then it's that lack of information causes anxiety. And so the more we communicate and get support, the better and more supported that return to work is. So from the two paths, that's why it's like early return is great, but if you even go beyond and go farther upstream from that, all of these components have risks. And if we don't manage those risks, then the employee, even if it looks like they should be coming back to work, might be at risk of re-injury. So in that first path, that lack of coordination, the lack of monitoring, it then might be where they come back and they aren't fully ready to perform the job duties and the physical demands of the job. And there's no real visibility and sign off on that. And they can either get injured again, another work-related injury, or even a personal. They could be at home and having, playing basketball with a kid and hurt themselves. And often, employers are they're like, well, one's work-related, one's personal. But now you have an employee not working again. So whether it's a personal situation or work-related, different insurance paths, you still have an employee's job not being performed and an employee's work not being done. So if you just think of that productivity loss alone of an employee being off, that's really important to think about. And then if you think about that coordinated care that I was describing and hitting job description, coordinated care, appropriate return to work, then the employee comes back and doesn't have that same sort of risk that we would see if it was unmanaged or unmanaged or managed in an appropriate way.
Agree. And when we're talking about some of these certain injuries that we had referenced before, it's interesting because you have to be very specific, because there is one category that carries a little bit more risk than some of the others. Dr. Marley, do you have 2 minutes to kind of go through this with us about musculoskeletal? Okay. All right. Good deal.
And I actually wanted to share one more thing, actually, just to kind of piggyback. Again, when that one employee is out from that injury, it's not really just about that one employee either, because like I was said, their job's not being completed by them. So now we have to find other people to step up into that role, whether those people are cross-trained in that role or knowledgeable of that role, or whether it's people picking up overtime and trying to work faster, quicker, harder, whatever it is. Now we're also predisposing other people to higher risk of injuries from trying to backfill. So that's why it's always important to be proactive instead of reactive, and doing these ergonomic assessments and kind of going through on a very common basis just to see what the different risk levels of these different jobs are, and making sure that, we are taking care of these employees and trying to diminish these risks before they even happen.
Absolutely. Do you see that the majority of those are musculoskeletal that you're seeing? I know that we were showing 30% on here, but I mean, what do you see in your own practice? Do you see that the majority of those are musculoskeletal as well?
Yeah, I would say majority of it is musculoskeletal, just those strains and sprains, whether people, again, rushing because they have a certain pick count or have to do something in a certain time period. And so, they lose those mechanics. They don't lift with their legs, but they're lifting with their shoulders and their back, and they're tugging more so. Or they're just trying to hurry up and get things done, or, just, again, their environment isn't conducive to their job. Working on a table or something that is too low for them, or maybe even too high. And so, again, that's the highest that I've seen, and it's a significant percentage of these workplace injuries, and they're also some of the ones that are more likely to reoccur, just because those muscles have memory. So I don't know if anyone in here has ever pulled their hamstring, right? So it's one of those injuries that's just kind of, unfortunately, I know from experience, kind of almost never go away, right? So as soon as you try to ramp up or do a little bit too much, that muscle could just tighten up on you a little bit, and it says, hey, I remember last time I was overstretched, this happens, and your body gets really protected. And so now people start to compensate and move in a different manner, or try not to twist or turn with their back. If they had a lumbar strain, they try not to use their back as much, and now they might be reaching more, and they might be using their shoulders a little bit more. So again, it's just that kinetic chain. When one spot is injured, our body's going to try to find a way to accommodate and compensate. And unfortunately, that opens us up to potential of different injuries.
I agree completely. Dr. Rowley, thank you so much for joining us today. We won't keep you from your patient any longer, but we enjoy seeing you, and we always appreciate the amazing expert insight that you provide.
Of course. Thank you guys for having me.
You bet, you bet. Dara, I'm going to come to you with sort of a different question that's here in the chat, because you do have a bit of the HR background. You started in HR. I'm sure that not everybody has faced this particular situation, but John Kirk was asking, we have an employee that is out on personal injury, and we've offered them a modified job assignment. However, they're refusing the offer. So as an employer, or as an HR department, what is your response at that point? How do you navigate a situation like that?
I think it's dependent upon what's going on. I mean, there's got to be more context to what's happening with this employee. So typically, HR would be having conversations or figuring out what's going on. And if that employee, it really depends on what their why they are out and what the issues are. No, I don't know that you can, of course, force an employee on personal injury back. But I think that's where good case management support comes in. Clinical case management support, that is one of those benefits of having somebody as a third party have those conversations with an employee, because it feels less threatening than an employer having those conversations. And it's a little bit more about making sure that employee feels supported and understands the why. So it's not just, and I think a couple of people have mentioned this, when you have employees that are struggling and out, one of the best things you can do is for their mental and physical health is to get them back into the workplace. And often employees don't always realize that. So helping educate and find out and dig a little bit more to the context, case management on both the personal and work-related leave side is definitely a critical component of that.
Completely agree. Dan, you are just a wealth of information in this chat. I love when Dan adds so much to the chat, but I love this one that he said, employees sometimes hesitate to utilize the Safe Return to Work program. However, it's important to understand that the workers' compensation typically only covers 66 to 70% of their regular wages. So our program is designed to help employees maintain that normal income level while safely returning to productive work with a really well-structured plan. And that is so important, because as an employee, personally, if all of a sudden I was only going to make 70%, 66 to 70% of my paycheck, definitely that would have an impact not just on me, but also on my family. So I really commend what you had mentioned there about coming up with some different options so that you can get them back into the workplace there. Great insight. Dr. Cherry, anything else that you wanted to add on the musculoskeletal injuries?
So just thinking again, I do really believe it's about the individual's capacity to do the work. And so there's obviously going to be a distribution across all of your employees who the work maybe is at or above their capacity, and some are below their capacity. So if they sustain an injury, especially if it's moderate to severe of that joint, ligament, tendon, or muscle, and again, if it's moderate or especially severe, it may take them more time to regain full capacity that they had innately. And then if it's a severe enough injury, they may never actually get the full capacity that they had before the injury. And so just to be aware of those types of outcomes.
Absolutely. Yeah. Well, let's talk about the cost that kind of comes through some of these, because this is the number whenever we talk about what gets leadership's attention, or whenever you're asking for something from a leadership level, this is numbers are what get their attention. And Dara, I'll come to you first, but talk to us about the cost that's associated with this.
Oh my gosh. Yeah. I mean, we know some of these numbers, and I think a few of you that are safety in the audience are saying, of course, injury prevention is key. If injuries aren't prevented, a claim, a case, a sprain strain on average can cost $32,000. And then there's all these indirect costs. A couple of people mentioned, and we just talked about having to deal with the team that is down a person, or if they're down a person and they're not all cross-trained on it. I think a couple of you have also said not only these are like the employer costs, but there's a huge cost to the employee as well. Jeremy was saying Florida holds the first and last paycheck for work comp. So they lose 30% and 2 whole weeks of pay, not just the 2/3 pay plus, loss of overtime. So that's part of that component around education, is making sure employees realize the cost themselves. And then there is that cost to the business. It is also, it is a productivity cost. It is a bunch of other components. And we see this a lot when industries are laying people off, and they may be laying people off. And then what ends up happening is people that are not used to the job duties end up filling in, or the same thing. You've got employees injured. It's the same kind of issue where you end up having employees not used to the physical demands of that job performing the job duties. So there's risk then elevated for the whole team, not just for the individual employee.
Great. I really like what Renee said because we're seeing this everywhere, and it speaks to the aging population. Should mention we have a foreman lead stretches before work. However, we have an aging workforce, as I lovingly refer to as our geriatric basins, and they've done a lot of physical labor over their careers, and the wear and tear on their bodies eventually catch up to them. Their recovery time is longer because they don't recover as quickly in our younger employees. However, we can't discriminate based on the age during that hiring process. We have a lot of employers that are facing this challenge. In fact, we've had summits and things like that where has came up so frequently, where they're talking about what is it that you do, because you have these older workers that are aging out of the workforce, but they're not ready to go yet, but they're still not in that physical condition where they can perform the same job duties that they could before. A lot of great ideas that I've heard from some of the different clients were that they're moving some of these veteran employees into instruction type roles or education type roles, so that they can really be more of that mentor versus actually having to do the physical labor itself. Dr. Sherry, do you see that as well? Is that kind of where the trend is and what you're seeing in terms of the aging workforce? Dr. Sherry?
Yes, sorry, I missed that first part, but I think I figured out my connection problems. It's more my camera, but I apologize for being in and out. But yes, I think that really those are great points about age and capacity. Although we cannot discriminate against age, I think what this really shows is we all need a great process to manage evaluating the capacity of each worker. And although that one point you read from the audience showed potentially older population having less capacity, I've actually seen it opposite, to where younger populations may not have the work capacity because they've cut out physical education in the workplace, or because video games become so popular, certain groups are less physical. And so I think just having the capacity approach or a process approach, looking at capacity at pre-placement and then obviously at return to work, that really is going to be more and more important as we do have these demographic shifts.
I agree. Well, Dr. Sherry, one of the questions that always comes up with this is that, how is it that an injury can still occur while they're in that return to work type of stage? So it's like, it's kind of hard to almost internalize sometimes. So it's like the employee is returning to work, but it's not necessarily the end of their recovery. It's just a change in the setting that they're in. What's happening with their body as they're trying to recover from that injury?
Right. And, I think in many ways, the goal is for rapid return to work, but at the same time, you have a competing principle of perhaps not early return to work at full capacity. And when we think about it again, biologically, when there's a moderate to severe injury, in the beginning, things are very painful, very swollen. We feel very weak around that area. But over time, that first stage of the injury starts to move on, and we go to the second stage. So we go from inflammation to kind of this proliferation of repair mechanisms at that joint. And so you have a lot of cleanup. It's like a little construction site at the joint or in the muscle. And so then pain reduces, swelling reduces, and there is this early form of healing. However, capacity is not back to 100%, capability of strength, of resilience. And so that potentially can happen, again, once inflammation finishes and then this proliferation occurs, you have this construction basically at the joint, but then you need more time where that soft tissue fully remodels, whether it's, depending on the soft tissue, it can be tendon, ligament, or muscle, and it does take weeks to months to get back to full capacity, especially if it's a severe injury. So that's why you see this reduced strength and lower tolerance. Again, though, I think there's many reasons to do early return to work. When we've talked about the psychosocial aspects, not being alone, not being in isolation, right? There's a huge community aspect to work that I think many people, may be their only form of community, so to speak. So that's a whole nother topic. But again, that's how I see it.
Yeah. The next piece of this, I think that you've covered a lot of this, but what really stuck out at me was that that's how re-injuries really happen. And my question to you, Dr. Cherry, specifically is, if you were in the shoes of a supervisor or a return to work coordinator, or whatever it may be, a safety manager, what would you be monitoring once those employees do come back to work?
So I think, checking in with them at the human level, just because we're really understanding how important the psychosocial aspect is of an injury. And so feeling alienated is one of the worst things that can happen to an injured employee, whether they're returned to work or not, but also seeing how they're just doing in general, but also kind of seeing how they're doing their activities, especially the physically demanding ones, and just checking in with them to see if the, rapport really goes a long way here. So if there's no rapport, I think it's going to be difficult to manage as a supervisor an injured employee return to work. So having rapport really does help with, I guess, obviously employee relations in general, but also this very delicate time of return to work.
Completely. In terms of kind of what that looks like and where that risk lies, a lot of times that we find that there's a disconnection there. Sometimes we had referenced this a little bit before about, is it the provider that there's a disconnection with, or is it the employee, or is it the employer themselves? So, a lot of programs stop at that return, but the risk starts after, is what we always say. But where do you feel like that there's gaps? And I'm open to Tara. I'm always open to your input here as well, where those gaps exist.
So I think the gaps exist, and every employer probably has strengths and weaknesses in their programs. So it may be stronger or a stronger part of their program or a weaker part, but I do think the gaps exist here across. Is there a position description with physical demands for the provider to understand the physical demands of the job of that injured employee? And also, once they are returned to work, again, what is that process? Is it just going from being out to 100% fully back to work, doing all of the physical demands, or is there this graded? So I think every employer needs to look at their program and try to look at where their strengths are and where their weaknesses are to prioritize where they focus their intentions.
Really good point. Excellent point, actually. Darren, tell us what strong programs, some of our best clients, what are they doing differently that you would recommend to other organizations as we wrap up?
Have it in place before you're dealing with it. So make sure you're talking to all your stakeholders before we're dealing with a lot of these tough moments. So make sure you've got your job descriptions in place. Make sure that you've got a clear-cut process for how to handle injuries. Make sure you've got those clear handoff points that you make sure employees don't lose sight of what the process is. I think making sure that you're training and educating every step of the way, making sure that you know exactly what to do once these situations come back or come up, because that's the worst time to try to scramble and fit programs into this. So then when you are returning somebody back to work, you know how to support that process, where we can set up light duty or modified duty, and then make sure you get that support at every step of the way, and those employees will be able to come back safely.
Absolutely. Well, thank you all for joining us. You've been a fantastic group. We always learn so much from you. And I appreciate everything that you share. Again, we've read everything that's here. If you have not already, make for sure that you click that registration button that's there at the top right-hand side of your screen. And that will get you signed up for How to Speak CFO. You know, it's almost kind of like it's its own language. They speak in a different language sometimes than what we think of. But we definitely want to make for sure that you have the tools in your toolbox, especially as budget seasons or you start thinking about budget seasons for 2027. We want to make for sure that you have all the access that you need to get all of the protections that are appropriate for your employees. So we look forward to seeing you in July, and I hope that we get to see some of you at ASSP in Anaheim, California. So thanks for joining. We'll see you next month.
Thanks, Holly.